All right. Hello, everyone. Dr. Nikhil Verma here with another edition of Things I Didn't Learn in Med School. This is a presentation that I'm going to be presenting to a physical therapy group in my area next week. And I wanted to kind of go through a few topics that might be interesting and might be beneficial for physical therapists or other practitioners to say, why do you want to practice with a interventional pain management practice in your area? And yeah, I hope you find this useful. So, a little bit about me: board certified physical medicine rehabilitation, fellowship trained in interventional spine and musculoskeletal health. I have a big passion for regenerative medicine, some of the memberships, et cetera, et cetera. One of the big things in my practice is we're a non-opioid based practice. We actually do focus on preventative measures. We focus on functional measures. We try not to even prescribe medications, as we know that non-steroidal anti-inflammatory medications can be net negative for our bodies, whether that be for causing ulcers, kidney damage, or now the emerging evidence of increased risk of heart attack and stroke. The other idea for our practice is, we're preventative. We want patients to avoid surgery at all costs, if possible. And we can't do that without a comprehensive approach. And we can't do that with partnering with our local chiropractors and local physical therapists. Now, quite frequently, what I'll tell patients or the physical therapist that are referring is, my goal is to try to get patients over the hump. If they've hit a plateau in their physical therapy needs or in their training needs, maybe they do need to take a closer look at having some sort of steroid injection or pain block or nerve block, or just getting the proper diagnosis with diagnostic imaging of MRIs or diagnostic ultrasound. So these are all topics that can help progress our patients in their healing journey. Now, the other thing about my practice is we focus a lot on regenerative medicine using prolotherapy, platelet-rich plasma, mesenchymal stem cells, either from lipoaspirate fat or from bone marrow concentrate, or our MLS laser machine that we have in office. One of the big problems that we have with our system is the bottleneck. The university and hospital systems, they have long wait times for specialists. Months can get delayed for MRIs, and patients' progress stalls, and the patients are stuck in this limbo. One of the things that was highlighted to me this week was how the delay of care continues for these patients. I have a patient of mine who was supposed to have surgery, and they didn't get the authorization. Now, the problem is the orthopedic center that was supposed to do the surgery for this individual, they didn't tell them until the day before. And the patient was kind of lost, like, hey, what do I do now? Well, it took her significant other to call the insurance company and be, hey, what can we do? And I also had to call the orthopedic practice. Now, the orthopedic practice, we never put in an appeal. We can do that now. So why did it have to take the individual to call the orthopedic practice and the insurance company to try to get the appeal? And now the appeal process is going to take anywhere from 2 to 4 weeks. So the surgery that was planned for a couple of weeks ago is now going to be delayed a month. And this individual is waiting for their surgery before they went on to start their new job. So now they're going to have to wait to get the surgery no matter what. So this is kind of the system bottleneck approach where we're relying too much on the hospital systems or these orthopedic centers to get what we need done and not relying enough on the tools that we have available. And that's where an individual practice can come into play. So again, here's some independent advantages. In my practice, we can usually get patients in 1 to 2 weeks. We get the diagnosis right away, diagnosis imaging if needed. And of course, we have to play the game that the insurance companies want, that 4 to 6 weeks of conservative care, failed treatments, failed medications, failed procedures, et cetera, et cetera. But the idea is we can get this done in less than 2 months if done appropriately, and get these patients back to physical therapy in a shorter amount of time. We're bypassing administrative bloat. We're fast-tracking diagnoses with x-rays, MRIs, EMGs, and nerve conduction studies when needed, ultrasound exams when needed, and we're getting effective treatments for patients a lot faster. So instead of waiting 3, 4, 6 months just to be seen by an orthopedic specialist or getting on their surgical schedule, we're here. We're getting things done within 2 months, and that's going to make the world of a difference to a lot of the patients. Also, it's going to help prevent going from a mild to moderate pain into or an acute or subacute pain to a chronic long-term pain progress that we do see happen. So just a little bit more. Again, this is not really geared towards individuals watching on the YouTube channel, but it's just more of, hey, we do things a little bit different here. I know of practices that will not go over their EMG and nerve conduction studies with their patients. They just show them the results and not even explain what the results mean. MRIs and x-rays. I require all my patients to bring in their MRI and x-ray exams. Now, I had a patient just this week who was saying, oh yeah, the doctor kept treating this based off of the MRI report. When we sat down and looked at the MRI together, the nerve compression was clearly on one side that was documented by the radiologist and treated by the interventional pain doctor. But when we looked at it together and we talked to the patient, they said, my symptoms are all on the other side. So as we looked and dug deeper, I'm not going to say the radiologist misread something. Maybe they just underreported it. I saw a clear compression of the nerve on the other side that was missed. And I said, that's the reason why we have to bring in our own images. And we need to go over these nerve studies with patients. Of course, dynamic x-ray review. Quite frequently, practices will just order standard x-rays without having a flexion extension bias. And that will not be enough for what we need to do. If we see a degree of instability in these x-ray exams, that's going to help guide us to treat these patients with either interventions or, in the case of physical therapy, hey, we need to focus on this segmental disruption so we can help our patients get better faster. So again, these are some things that are diagnostic and beneficial for our patients. Another benefit in my practice is we get to spend the time with our patients. We do talk about diet recommendations and not just hey, you need to eat healthier. I've actually made pamphlets and handouts for patients of a anti-inflammatory diet, Mediterranean diet, the ones that have the most evidence with tons and tons of foods that are recommended. Supplements, of course, have their own controversy. None have randomized controlled studies. None are really very, very well studied. We do a lot based off of what the studies suggest, and whether that be animal studies or the non-RCT studies that we have available. I do give recommendations for supplements because I do think supplements can be beneficial, but they aren't there to replace. They're there to supplement. And we don't try to over-supplement. We try to find the most effective 3 or 4 supplements so that people aren't wasting thousands and thousands of dollars each month, like a Dave Asprey or Ben Greenfield. But we do want you to have enough information of some things that might have some evidence and might work. And I always say we need to give it a try. If it doesn't work for you, then we know it didn't work for you. And we document that and we move on. Peptide therapy, that's something I talk to a lot of my patients about. That's not something that we have necessarily to offer for our patients, but they come in with the questions. And I want to be knowledgeable about it because I want to give my patients the best information possible. And in later lectures in the next few months, I'm going to be talking a lot more about these peptides and hopefully give some more beneficial information about it for people out there. In our practice, again, we focus a lot on regenerative medicine. I have plenty of videos on that. We'll talk more about that in the future. Just briefly, the platelet-rich plasma, mesenchymal stem cells, bone marrow aspirate, adipose-derived therapies for tissue repair, prolotherapy. What's not mentioned on this is our MLS laser therapy as well. Other things that we have to offer in interventional spine services, radio frequency ablation, spinal cord stimulators, peripheral nerve stimulators not on the slide, the Minuteman procedure, and reactivate. These are minimally invasive procedures. We also have SI joint fusion, minimally invasive devices in that capacity. So in my practice, we treat back, neck, joints, SI joint, headaches, neuropathy. We have a large menu of items that we can help for patients, just depending on what their pathology is and what they're looking for. One of my, poster child success stories is Jane. She had 10 plus years of back pain, did physical therapy, chiro, RFAs, epidurals, et cetera, et cetera. She opted to choose for regenerative medicine therapy, and after 6 weeks, she was actually 75% better. She was able to walk 200 feet down her driveway and back repeatedly without pain, which she was unable to do prior to the procedure. And one of the biggest things I find about this patient is she believes in these therapies, regenerative therapies, so much. Now she's actually coming back to get her shoulder done. So we have a consult, and we're going to talk about, see if there's anything I can help her. And one thing about my practice is I'm honest. If I'm not able to help you, I will tell you, and I'll try to get you to the people that can. But that's a benefit of not having to answer to someone else in a private practice. I'm able to make that decision call, and I'm not just using patients as a paycheck. And I'm not just using them to make ends meet and meet quotas that are required from a board who may or may not see patients. I'll skip this other patient. This is, again, more geared towards, but he was a ex-pro mountain biker, and he opted for regenerative medicine therapy as well. So why partner with Essential Sports Defined Solutions? Patients are seen in 1 to 2 weeks, immediate ordering of MRI and EMGs when appropriate, and as long as they've met the insurance requirements, zero opioids, surgery prevention focused, access to PRP. This is not supposed to say access to peptides, but access to information to peptides, access to stem cell therapies. We work with our physical therapists. We work with our referring physicians. We work with our referring chiropractors. This is not a competition. This isn't to try to steal patients from one another. We really want a comprehensive approach, and with that comprehensive approach, we can definitely help more patients out there. All right, so I hope you guys found that useful. If you are in the Columbus area, here's some information. You can book a discovery call or book an appointment with us, and I'm looking forward to helping you out there. Hopefully you guys found this useful. I know it was a little bit quicker and a little bit more to the point. Again, this was more geared to a lecture I'm giving later next week, but if you have any questions, feel free to drop them below, drop me some comments. Don't forget to like and subscribe. Yes, take care. Bye.